Hey future nurses, welcome to my video on NCLEX delegation strategy. I'm going to give you my step-by-step guide. This is going to help you answer any delegation question on the NCLEX exam. So let's get started. Now, when answering NCLEX question about delegating tasks to an unlicensed assistive personnel, I want you to follow these two key steps to ensure the correct answer. When you do this, you are going to get the correct answer every of the time. Now, step one is to identify the tasks, right? And check if a UAP can perform them. Now, when you identify the tasks, you are going to ask yourself, can a UAP perform these tasks? Now, there's two things that can happen from step one, right? If there's only one option with a UAP appropriate task, that is your answer. You don't need to think about what is the condition of the patient. In as much it's just one option that the UAP can do, one of those tasks the UAP can do them, and the others the UAP cannot do them, automatically that's your answer. So it makes the process very easy without not thinking about if the patient is stable or not, right? Now, but if you have more than two right tasks, then you need to do step two. Now, step two, you are going to choose the most stable patient. That's what you want to do. Now you have two tasks that the UAP can do. Now you have to now select one of those answer based on which patient is more stable. So that's basically what you want to do. Stable patient for the UAP, unstable patient for RN, right? So if you end up now having the UAP appropriate task pairing with stable patients, that is your answer. So now let's get started with example question, applying to strategy. Now look at our question right here. Now one thing I want you to take note when you are answering NCLEX delegation question is the stem, right? Take note of this stem, guys. Take note of the stem, because the stem need to tell you that you are doing assignments, right? There's two ways the NCLEX can test you on the delegation. Is either they test you on assign or they test you on best direction. So I'm actually giving you strategy on how to assign. So now always look at your stem, right, to be sure what the NCLEX is asking, so that you don't be so excited when you see a delegation question, right? Always make sure you confirm that is you are assigning, right? So if you are assigning, this strategy is definitely going to work for you. So let's move on, guys. Now, if you look at the options, right? We From step one, we try to identify the tax. Now, what is the tax? The tax is what we are seeing the UAP to go and do. Beat the patient, obtain vital sign, right? You understand? So that's the tax, right? Beat a patient with Alzheimer's, a patient that has Alzheimer's, right? Alzheimer's is the condition. So, but step one is the tax. We are dealing with the tax. Apply condom catheter, right? That is the tax. Apply pressure dressing. That is the tax. Obtain vital sign. That is the tax. Insert NG tube. That is the tax. Now, if you look below right here, you can see I have already done the work for you. Now, you are now going to ask yourself, can the UAP apply condom catheter? It's allowed. So that's why you can see I placed allowed right there. Can the UAP do pressure dressing? No, they cannot do dressing. The only dressing they can do is putting on clothing for the patient. That fall within ADL. But dressing, stab wound, no. You understand? They cannot do that kind of dressing. So that's why you can see not allowed, right? Can they obtain vital sign? Yes, it's allowed. That's why you can see allowed. Can they insert NG2? No, because that is invasive procedure. So they cannot do that. That is the reason why you can see everything I have here on the screen, right? Allowed, not allowed, allowed. Now, at the end of the day, we have two options right here. We have 1 and 3. You can see 1 and 3. So that's why I said when you have more than two tasks that the UAP can do, then you have to move on to step 2. Now, step 2 is now trying to see which is the appropriate answer based on the condition, and the patient must be stable. Now, this is number 1 and 3, option 1 and 3. Now we are done with the task. Now, what is this patient experiencing? This patient has hip fracture who is incontinent. This patient is experiencing delirium tremens. Now, make it very much easier, right? Now you just want to choose the most stable patient. Now, who is more stable? We know a patient with delirium tremens is not stable because they have the risk of seizure and hallucination, right? So, uh, what are they calling it? The UAP cannot deal with this particular patient. This is the best choice for the UAP. So that is the reason why 1 is the final answer, right? This process is going to help you out in a way that you don't get to be confused, you don't get to overthink, you don't get to stress yourself. Like, this is the good formula that you can implement when you answer delegation question. And trust me, when you have one delegation question on your exam, there's chances that you have more than one at the end of the day. So imagine doing it this way, a way that will not give you stress, that will not get you confused, overthink, right? Second guess yourself, then doubt yourself. Then your 2 points is secure on the exam, and you're working your way up to above the passing standard on the NCLEX exam. Now, moving forward, let's try another example, right? Remember, I said there are sometimes even with the tax, you can just finalize the, what are they calling it? The answer. Now, look at this. Now, step 1, we want to identify the tax. So what is the tax right there? This is removing condom catheter. This is evaluating the patient pain level. This is providing discharge station. This is determining, right, the effectiveness of anti-anxiety medication. So those are the tax, right? Now, we want to now know which of them the UAP can do. And you can see right here, the UAP can definitely remove condom catheter, but they cannot evaluate, they cannot provide a discharge station, they cannot determine the effectiveness of an anti-anxiety medication or any medication in general. They cannot do that. So understanding that they cannot do that, automatically you just have one answer. So at this point, we don't even need to think about what the patient is experiencing, because automatically we have already been able to eliminate all this. So one answer, there's no point of looking at the condition, right? The main reason why I created this formula, right, is because I want to make sure that uh students find delegation question, most especially how to assign, right? Easy. Because one thing I found out from my 2 years of coaching is that when you ask some certain student to do delegation question, they tend to think about two things: the task and if the patient is stable. That's when I realized that yes, more than one question in that delegation question. One, you need to know your scope of practice. Some students struggle with scope of practice, and some students struggle with knowing which patient is stable, right? They struggle with knowing which patient is stable. Now, having to think about the whole 4 option is very difficult. So, how would you be able to, like, reduce the option? Deal with the task, then deal with the condition. It's easy to now say, okay, which patient is stable, which patient is not stable, like which patient is at risk for complication, dying, life-threatening, all that kind of stuff. And then you get your answer easily, right? So now I want you to utilize this method, right, in any delegation question you see, and you're going to find yourself answering the question correctly. Let's talk facts. 50% of test takers fail the NCLEX on their first try. The test is designed to trick you, not to see what you know, but to confuse you, right? Another thing is that repeating the same study method that did not work before will not magically help you pass. The thing is, you already know this. So why would you risk failing again? Okay, what if I told you there's a formula hidden inside the NCLEX question? A way you can outsmart the test, beat the trick, and pass without drowning in useless study material. Let me introduce to you my NCLEX Insider System. This is not another boring study guide or do more practice question strategy. This is a proven step-by-step system that flips the NCLEX on its head and give you the advantage. Here's exactly what you get. You are going to get my NCLEX test writer playbook, right? You are going to learn how the exam creator designed tricky questions so You can break them apart and pick the right answer every time. This is amazing. Whereby you know how the examiner writes the question and you know how to break it apart and pick the answer every time. I'm also going to give you my shortcut to success answer system, right? No more second guessing. This method is going to tell you which answer is correct, even when you are clueless. Wow. I'm also going to give you exclusive NCLEX memory app training. The reason why I'm including this is because I noticed that even if I reduce a large content to a small content, some people still find it difficult to still know it. So why not? I added this NCLEX memory app training. This is why I'm going to train you how to retain everything you need to know fast. No more drowning in useless notes. You're also going to have access to live coaching call on Zoom and my private study group. You're going to get personal uh access to me and my community of serious NCLEX test taker. Lastly, I'm going to leave with you my 30 days NCLEX fast track plan. And trust me, when you follow this simple daily roadmap, you will pass in 1 month. If you complete my program and don't pass, I will refund every penny and pay you $500 for wasting your time, right? I don't just believe in my system. I am betting my money on your success. So at this point, you have a choice. Now, either to join today and pass the NCLEX the smart way, or you ignore this, keep guessing, and risk failing again. Don't let this test see more of your time, money, energy, confidence. Take the shortcut to success. Now, DM me ready. DM me the word ready on my Instagram at futurern_pm.